The Welfare Subcommittee has been fully engaged in attempting to fulfill its mandate, and we have been collaborating very closely with the Food and General Supplies Committee. We realize that both committees have similar roles, and so one of the things we did earlier today was to meet to ensure that we do not duplicate our effort. And we were able to clarify certain pertinent issues, and we think that we are, from tomorrow, going to work a bit more closely and ensure that things work in the correct way. The role of the Welfare Subcommittee, Welfare and Supply Subcommittee, is to identify the needs. So all needs would be channeled through the Welfare Subcommittee for food and general supplies, and then we would channel those needs to the Food and General Supplies Committee. We were trying to, in our discussion with Mr. Thomas today, indicate that there could be confusion if everything does go, what should be done by the Welfare Subcommittee, that everything goes directly to the Food and General Subcommittee. For smoother running, we feel that it should be channeled in the proper way to ensure that things work properly. That doesn't say that Mr. Thomas of the Food and General Supplies Committee cannot use his judgment if certain needs come up, but for better collaboration, we feel perhaps we should ensure that the roles are not duplicated. We have been, since yesterday, working with persons in the critically affected areas in terms of identifying their needs. And we made contact with a number of individuals, chairpersons of the shelter committees, and they have indicated to us their needs. And we also have been working with institutions, about 10 institutions, including the Princess Margaret Hospital, institutions caring for the elderly, and Chances Yes We Care program. Chances, as we know, house children who are in need of care and protection, and we were able to identify what exactly those institutions need, and we have channeled those requirements to the Food and General Supplies Committee. What we identified too is the number of persons who are at the homes of individuals, and we realized that while we're working with the critically affected areas, we also need to focus on assisting those families, because a number of families have been identified who have taken persons into their homes. Even late this afternoon, the report came into us that one person in Fokole has about 17 persons, as to how those persons live in one house. But we were told that they want it that way, because we questioned why so many persons in one home, and they felt perhaps from different families, but similarly they want to be together. And first thing tomorrow, we are going to try to see how we assist those families that were identified late this afternoon. In our discussion with the Food and General Supplies Committee, we realized that particularly for those families, that we need to adopt a different approach. Since the Food and General Supplies Committee distribute in bulk, we would need to see how we put some mechanism in place to have smaller packages done. And so that is where we are appealing for volunteers in that regard. And one suggestion is, why not some of the business places could offer some of their staff to come in to help in that area. I think that would be a very good gesture if some of the business places could release some of their workers, and we can contact could be made with the Welfare Subcommittee through the EOC to obtain the names of persons or institutions or some of those business places willing to assist. We know that there is also a cadre of volunteers, and we would also see how we get this. Because what we're talking about is going to a particular building and having supplies there to be packaged, not merely thinking of it as a ration, because in times like that we also say, well, we're giving out ration, but regard this as supplies that are going to persons in need. So we are appealing for help in that area, and we hope that persons would respond in that regard. We we had a visit this afternoon, and some good news in that regard, where a representative of Nagico companies in the Caribbean flew in from St. Martin and had discussions with the welfare subcommittee. And Nagico Caribbean is liaising with the Caribbean offices, and they have pledged 75,000 EC dollars food vouchers. So what they have done, they have identified 3 of the supermarkets here in Dominica, and they have actually printed those food vouchers of $100 each and asked us whether we could identify persons who would be in need of those food vouchers. It's they said that they are prepared to give further donations, but the $75,000 would be at least for 6 months in the first instance, and at $100 each, but not restricted to $100 per family, but families and individuals we identify who would be in need. And we have already started a process of identifying persons in the critically affected areas. So while there may be persons in shelters and persons in the homes of individuals, there are other persons in the communities who have been affected tremendously. And assessments have been done through a team of assessors on the ground to identify those persons. And so as we identify those persons we need, very likely some of them would qualify for this $100 food vouchers. They will go to the supermarkets and be able to obtain various items. But the representatives clearly said not items like alcohol when she presented the food vouchers, and indicated that perhaps particularly those from Petit Savannah. But they have left it up to the committee to identify those individuals. We are talking here about immediate needs, but as we look to the future, we also keep at the back of our minds short-term and long-term needs. And so that is where assessments would have to continually be done to identify the long-term needs of individuals, and that is also a part of the work of the Welfare and Supplies Subcommittee. Another area, while we focus heavily on providing the material or the needs of individuals, we realize too that the psychosocial support which needs to be given to individuals is also very important. And in that regard, the Welfare Subcommittee is liaising with a pool of therapists, counselors who have been identified to provide psychosocial support to individuals. And the team of counselors are working in those critically affected areas, doing one-on-one and group counseling with individuals. And we thought too that we should use the media houses. And so with the assistance of Mervyn Paul, a number of those media houses have been identified, and those counselors will be go into the various media houses to disseminate information, particularly tips of how to cope in times of disaster as we have on our hands right now. Because we know that the psychological effect and emotional effects could be such that if the psychosocial needs and the therapeutic needs are not taken care of, there could be counter effects. So that has been attended to, and those programs will be aired tomorrow, both on, in fact, GIS is down to do a recording of one of those programs to at least give certain tips to members of the public how to better cope in this present time of need. So that is where we are. The work is going to continue tomorrow as we continue to liaise with the Food and General Supplies Subcommittee.